Hello and welcome to today's Parent. My name is Christine Casina and I'll be your host. On today's Parent, what we are passionate about is connecting you to experts and providing you with information to make your parenting journey an awesome one. On today's show, we'll be talking about pregnancy and conception. It is something we never think about. Even before we get pregnant, we need to think about, getting pregnant. And on today's show, we have Dr. Monda, an obstetrician gynecologist.
Yes.
Passionate about reproductive rights, and also a lecturer at Kenyatta University.
Yes.
Welcome very much to the show.
Well, thank you for having me, Christine.
Thank you for coming. So, when it comes to matters pregnancy and conception, take us through what is conception?
Conception is simply fertilization. That's when the sperm fertilizes the egg. That's basically it.
Okay.
Okay, there are very many factors that lead to that. But the long and the short of it, just defining the word conception is fertilization.
Okay. And is it something that happens automatically? Because, when we come of age, we then assume that, for example, when we get married and we have sex with our partners, that conception will happen.
It's not as easy as people think it is. And it's not automatic because there's so many factors that come into play. And it takes two to make a baby.
Yes.
So there are factors that have to be in sync in the woman and in her partner as well.
Okay.
And those factors have to work together.
Okay.
So, for example, one, you have to have intercourse as regularly as you should.
Obviously.
Yes, it has to happen at a time when the woman is ovulating or
Okay.
has ovulated.
Okay.
The man has to produce enough sperm.
Okay.
He has to produce sperm that can swim, that can actually get to the egg. They have to be normal. They have to be the right number. They have to be physically normal. The woman's reproductive tract should also be healthy, should be accommodating to the man's sperm. The tubes should be open because fertilization actually takes place in the fallopian tube of the woman, and then that fallopian tube has to be able to transport that fertilized egg into the uterine cavity for pregnancy, for implantation to actually take place and for the pregnancy to progress. I always tell my patients, your systems have to be at optimum. One of the things you need to do is, one, you need to know your cycle.
Okay.
What a lot of people don't know is that the female egg, the viability, the time when that egg is actually able to be fertilized and to eventually form a baby, that window of opportunity is only 24 hours.
24 hours?
Yes, it's only 24 hours. And for men, their sperm is viable for 72 hours. They may remain viable in the woman's reproductive tract for a little longer, but it's an average of 72 hours.
Okay.
So, number one, ovulation. You need to have intercourse at a time when the egg is either has been ovulated, or when it's going to be ovulated.
Okay.
The woman's reproductive tract has to be patent for that sperm to actually be able to swim from the vagina where it's been deposited in the semen, past the cervical the mucus in the cervix, through the endometrial cavity in the uterus and into the fallopian tube. Okay. Then fertilization takes place, and then the fallopian tube is then able to transport that fertilized egg into the uterine cavity for it to then implant, and pregnancy then continues.
Wow.
Yeah. I always tell patients, your systems have to be at optimum. One of the ways you need to optimize that is, one, knowing your cycle so that you know when you're ovulating, when to best have intercourse.
Yeah.
Two, you have to be a healthy weight. Obesity also affects that.
Something we never think about.
Yeah, something we never think about. Safe sex is also very important. Also very important.
Okay. Back to the matter of the issue of weight. What would be considered obese when you're trying to get pregnant? Would you work with a number or?
Now, we always talk about the BMI, but for Africans, because we tend to have bigger frames, the waist to hip ratio, scientists have actually found that the waist to hip ratio is a better indicator. So, for example, just looking at me, if you use the BMI, I'm actually obese. But
based on you are?
Yes, just looking at me. But based on the waist to hip ratio, I'm actually where I should be. Yeah. So when you talk about the waist to hip ratio for women, it should be at least 0.8. That's 0. where you 0.8. Okay. Between 0.7 to 0.8 or below 0.8.
Okay.
And for men, it's below 0.9.
Wow.
Okay, for men it's below 0.9. Obesity has its issues. It affects our hormone levels. It affects how our body uses energy.
Yes.
Okay. It affects our hormonal cycles. So it is important for you to actually be the ideal weight, because if you're not the ideal weight, getting pregnant will be an issue, or
hard.
even sustaining that pregnancy to term will be a problem.
Will be harder.
Yeah. The same thing for men. We all produce the same hormones, by the way, but in different. Men and women produce the same hormones, but in different levels.
Okay.
Different amounts. Men produce more of the male hormones. Women produce more of the female hormones. So in men, if you're obese, that fat converts the male hormone into estrogen. Estrogen levels are elevated. It affects your sperm count. It affects even just your basic ability to even have an erection. And without an erection, of course, intercourse.
Of course, that will be impossible. You know what I like about what you have mentioned is that the responsibility of conception is not only the woman's responsibility, that both parties play a big part. Yes. And that is something that, just as a society, is something that we need to be very wary about. So when it comes to matters conception, for some people it's a bit harder. I don't know when, as a woman, let's start with women. As a woman, when should I be worried?
Now, we start talking about, and I'll keep insisting on this, Christine, we need to talk about the couple, the two, okay? Because both the sperm and the egg are important. It takes two to make that baby.
Very true.
Okay?
Very true.
So if you've been trying for 1 year of unprotected intercourse, that's without contraception.
1 year, minimum 1 year.
1 year if you're below the age of 35.
Okay.
And that's for both of you. Above the age of 35 after 6 months. Now that means regular unprotected intercourse. Now there's some mistakes that we make.
Okay.
People assume the more sex you have, the higher
the chances of conception.
Pregnant. That is not the thing, by the way. One, it turns something that really should be enjoyable into a chore, becomes a job.
Okay.
And then two, the more sex you have, the lower the sperm count. And you want to maximize, to concentrate the amount of sperm that is in that ejaculate every time you have intercourse. So we advise couples to have intercourse every other day, or every 2 days, rather than every day. Yes.
So it becomes, very pressurized, and like you say, it becomes a chore.
And then you need to have enough sex. That's another mistake people
What's
make.
Enough sex?
What I've mentioned, every
other
2 days.
Right.
If you have it once a week, and remember that window of opportunity I was talking about. Yeah, that 24 hours when the female egg is viable.
Yes.
Yeah. So if, for example, a couple comes in, the first thing we ask them is, are you staying together?
Yeah.
Because if you don't stay together, then the opportunity
you're
for
going
you
to miss
conceive,
that window
yes,
somehow.
Exactly. Yeah. So you need to have enough sex. So don't have too much sex, don't have too little sex. And then a woman also needs to know her cycle.
Yeah.
You need to know when you are going to ovulate. And we advise couples to have intercourse at least 2 to 3 days before the day of ovulation.
Yeah.
And the day itself. There are very many apps that you can use
to track your menses.
Yes, to track your cycle.
Right.
And that actually calculates for you the most optimum time, the most likely time that you will ovulate.
Okay.
Then
I wonder how accurate they are.
They're more accurate than us trying to count. Because you see, not every woman has a 28-day cycle where you ovulate always on the 14th day. And even women who have a 28-day cycle, that cycle can change. Either if she's traveled, just illness, emotional stress can change that cycle completely.
That is true.
Yeah.
That's true. That's true.
And then, you see, for our cycles, for a woman's cycle, it's the second part of the cycle, the period of time after ovulation that is a standard 14 days. That first part of the cycle, when you start counting from the first day of the last period, that is what varies. So for some women, they'll have 14 days before they ovulate, or it'll be 7 days before they ovulate, or it'll be 6 days before they ovulate. So that is why you'll find some women have a 21-day cycle, others 26-day cycle, 28-day cycle, 35-day cycle. Yeah.
Everybody's different.
Yes, everybody's different, and that's why the apps actually help.
Okay.
Yeah.
So after this 1 year of trying, and possibly more, I don't know. So at this point, should a couple consider IVF or?
No, you don't go straight to IVF, Christine. We need to investigate and find out why they are not conceiving. So there are all these things that we will ask. What's your cycle like?
Okay.
Do you stay together? How often do you have intercourse?
Yes.
Yeah. we check, are you overweight? Are you having a hormonal imbalance? And it's for both of them.
Yes.
Yeah? Then we investigate to start with a male partner. Because what we do is we check his semen. So we do what we call a semen analysis.
Okay.
And the good thing with that is it tells us everything we need to know about the man, whether he really is producing sperm or not, because he could be having an ejaculate with nothing in it. Yeah, and you know, the assumption is that once a man has an erection, he ejaculates, it's assumed everything is normal. No, he may ejaculate, he may not be producing sperm at all, or he may be producing sperm that isn't enough in numbers.
Okay.
He may be producing sperm, but
Okay.
then the concentration is low. So that the semen analysis tells us all that. And if a man is not producing sperm, it'll tell us whether it is something that is from the testes itself, or if it is in the tract of where the sperm, you know, the semen will pass before fertilization, before the man ejaculates.
Okay.
Now, when it comes to the woman, we check the cycle. Is a cycle regular or not? And if it isn't, we do a hormonal profile. Yeah, we start with basic things like checking out for thyroid gland disease, whether the hormone that makes us produce milk, called prolactin, is elevated or not.
Yeah.
We would then check to see whether her tubes are patent or not by doing something called a hysterosalpingogram, or what we call an HSG. We do an ultrasound of the pelvis to see how the uterus and the ovaries look like. Yeah.
Okay.
Now, taking all that into consideration, then is when we would then find out, you know, you should have been able to then find out whether there is a particular reason for them not getting pregnant. But there is a small percentage of couples, about 10% of couples who are not able to conceive, where we find everything is normal.
Wow.
And
Okay.
for a particular reason, they're not able to conceive. Now, when you've done all that is when you start thinking of things like intrauterine insemination first. Before you start thinking
Intrauterine insemination.
Where you actually take the man's sperm, prime the woman's ovaries to produce eggs, and then you inseminate.
Is that the same as IVF?
No.
It's
That's
different.
very different. That's
Okay.
very different. That's actually just taking sperm and putting into the woman's uterus.
Right.
Okay? To try and get the sperm as close as possible to the fallopian tubes. Because
Right.
the problem may actually be, for example, a hostile cervical mucus.
Right.
So the sperm is not able to get beyond the cervical mucus into
Right.
the egg. Yeah. There's some women who actually produce antibodies against their partner's sperm. So the sperm actually gets into the reproductive tract and is killed off by the woman's immune system.
Okay.
And then we start thinking of considering IVF when we have issues like what we call tubal factor infertility, where the
Right.
tubes are blocked. And you know, fertilization takes place in the fallopian tubes of the woman. So if she has a problem with the fallopian tubes, then we harvest. She's put on some hormonal treatment. We harvest her eggs at the appropriate time.
Right.
And then in a lab, fertilize them with her partner's sperm.
Okay.
And then take those fertilized egg and implant in the womb. That is now basic IVF. They're more complicated procedures,
Okay.
but that's the basis of it.
Okay.
Yeah.
I mean, in the conversations actually I've had with many women, the issue of blocked tubes is something that
It's very common.
quite
It's
common,
very
yeah?
common in the developing world. And in Kenya, it's actually the main cause of infertility.
Right.
We call it tubal factor infertility.
tubal
And it's
factor
because of
infertility.
the high incidence of sexually transmitted infections,
Okay.
particularly gonorrhea and chlamydia. Now, if a woman has been infected, let's say a couple are carrying gonorrhea and chlamydia,
Right.
you see, for men, they'll start having symptoms of very painful urination and passing pus from the penis after 7 to 10 days after exposure. So they are able to go for treatment.
Right.
Now, when it comes to the partner, remember this is an STI you're dealing with.
Yes.
How is he going to start telling his partner, I think that we have this problem?
Ooh.
And the partner keeps quiet because
course.
she herself is not having any symptoms. The unfortunate thing for us women is the bacteria that causes these infections ascends into the upper parts of the reproductive tract and then quietly damages the tubes. So for us, infections are hidden. For the men,
Especially for
yes.
women.
For women, the infections are hidden. For men, they are not. So you'll find this infection staying in the pelvis for quite a while. And because this is somebody who's young and healthy, the infection tends to wax and wane.
Okay.
And you see, it's like having a cut somewhere where you're cut, your body heals it, and then you're cut in the same place, your body heals it.
So
you eventually, the tissues then form, they become fibrotic. They're not as they should be. Okay, you form adhesions, and then there's some very fine hairs in the fallopian tubes that actually carry that egg when it's ovulated and move it along the fallopian tube. Those fine hairs called cilia are damaged by these infections. So fine, she's ovulating. This man is producing sperm, but the egg is either not able to get into the fallopian tube, or even if it is, it's not able to it's not moved. It's actually not transported by the fallopian tube into the uterine cavity as it should be, because those hairs are now damaged. So that is why tubal factor infertility is so common.
Understood.
Yeah.
Understood. Thank you very much for that. And we're now going to take a short break. We have been speaking to Dr. Monda on matters pregnancy and conception, what we need to prepare even before getting pregnant, and during this period when we are trying to conceive, the factors we need to look out for. We are going to be back after this short break. Welcome back to today's Parent, where we are talking about pregnancy and conception. The first segment, we've learned a lot from you. And in this part, the first thing I would like us to touch on is conceiving when you're a bit older, over 35. How does that go?
Okay, our fertility, both for men and women, by the way, starts reducing from the age of 35.
Okay.
It is true that men produce sperm the rest of their life, for their whole lifetime, but then the quality of sperm also goes down. For women, we are born with a full complement of eggs that we'll ever need for pregnancy. Okay, so by the time you're born as a girl, as a baby girl, you have about 2 million eggs in total in your ovaries.
2 million?
But you lose them. There's a natural attrition.
Okay.
You lose them, so that by the time you get to puberty, there are about in total 350 to 400,000 or a bit more in total in both ovaries.
Okay.
Now, every time you have your period, there's a certain number of eggs that has been recruited.
Okay.
And out of that group of eggs, there's this one particular one that responds to that responds best to the hormonal environment in the body, and that's the one that's ovulated. Okay. And if fertilization does not take place, then it dies off, and the cycle starts, and then you get your period and the cycle starts again. Now, your period is actually the lining of the uterus that has been prepared for pregnancy. Right. It's like how you prepare a garden every season for planting.
Absolutely.
So if that does not happen, you get rid of that and then start again.
Yes.
So the lining of the uterus is shed, and it grows again. This is happening every month.
Okay.
A certain number, you're losing a certain number of eggs. So by the time you get to 35, you can imagine the number of eggs that you have lost.
Yeah.
Okay. So the number is reduced. The quality also starts going down.
Okay.
So that is why we say, if you're trying to conceive below the age of 35, we will start worrying after you have tried for at least a year.
At least a year.
Above the age of 35, we talk about 6 months, because you don't have that much time left. Now, getting pregnant after the age of 35, the African gene pool is generally still healthy.
Okay.
Yeah. And
what does that mean?
Meaning, the risks of you developing, having babies with chromosomal abnormalities is not as high as in the West or in the Asian populations. Right. Although there is a risk, of course. Okay. Because the older you get, the lower the quality of the egg. Yes. Okay. And the higher the risk. Okay. But I'm a believer, Christine, in women deciding when they want to have their babies.
Right.
Yeah. And if you decide at the age of 35, that is when you want to do it, fine. If you decide you want to do it at the age of 40, it's really up to you. Yeah. It is true, there is a shelf life, there is a use by date, but I don't think society should pressurize us into having babies just for the sake of it.
Yeah, and just because we need to beat an age limit of when we should have our babies.
Yes.
And I agree with you, Dr. Monda. I think the other thing that's very, very important is when you're ready psychologically. Yes. So that is something that women need to be very wary about.
And you can decide not to have any.
And that's the other thing.
It's really up to you, yeah.
And the discussions are not easy when you go for those family functions and everybody is
It's not their business.
How do you tell them it's not their business?
You tell them it's none of their business. It's your choice. What are they going to do to you?
Oh my gosh, like those aunties.
It doesn't change. You're still their niece, you're still their daughter. It's just not their place.
It doesn't change. It doesn't change. And it doesn't take anything away from you that you're not a mom yet.
Exactly.
And if you decide not to become a mom.
Exactly.
That is true. That's true. The one thing I feel we don't talk about much is miscarriages.
Okay.
I don't know what your take is, especially for the first pregnancy. I have two kids, and I remember when I got pregnant the first time, I had a miscarriage.
Okay.
I didn't know who to turn to except, the doctor at the time, and you have a conversation. And sometimes some of them can just process you that, you need to go for, it's called an A and what?
An MVA.
And then, it is scheduled and it happens. And, if you are lucky, you'll get that emotional, psychological support. But what I've seen from the conversations I've had with many, many women I've lost a pregnancy, especially the first one, we don't talk about it. And I think it's happening a lot. I don't know what's your take on that.
Okay. Now, the medical term for miscarriages is abortion.
Right.
Okay? And there are different types of abortion. There's a complete abortion where everything just comes out on its own.
Okay.
There's the incomplete abortion where some of the products of conception, as we call them, some of the products of pregnancy are still in the uterus and you continue bleeding. There's a risk of infection.
Yeah.
So you either have to be taken to theater to have the uterus cleaned out.
Yeah.
And that's what you call the MVA.
Exactly.
Okay? Or there's an easier option nowadays because of some medication. We give you the medication. It makes the uterus contract to expel those products. It is uncomfortable, but it's considered safer than being exposed to the risks of anesthesia and occasional damage of the lining of the uterus, which may affect your ability to conceive later on. Then there's what we call a threatened abortion, where the pregnancy is still viable, it's still there, and it's threatening to come out.
Okay.
Then there's the inevitable abortion, where the pregnancy is going to come out regardless of what you do. Then there's a missed abortion, where you're pregnant, the pregnancy is implanted, continues growing, and then at some point just stops growing. Yeah.
So it's not a viable pregnancy.
It's not a viable pregnancy. And then we have the septic abortions, where more often than not, it's a woman trying to procure
So
an
it's
abortion.
An induced abortion.
Yeah, it's an induced abortion,
right.
And she ends up with sepsis.
Okay.
So there's all that. Now, the spontaneous loss of pregnancy is actually the definition of abortion, where you have spontaneous loss of pregnancy before 20 weeks, or what you would call 5 months of pregnancy.
Before 5 months?
Before 5 months.
Okay.
Yeah, before 5 months of pregnancy. Most pregnancies that you will lose in the first, what we call the first trimester, in the first 12 to 14 weeks, more often than not, those pregnancies are abnormal. And nature has a way of terminating pregnancies that are not viable.
Right.
Yeah. So regardless of what a doctor will do, that pregnancy will come out. Yeah, that pregnancy will come out. What is forgotten a lot of times is that loss of that pregnancy is actually a loss.
Yep,
and
that's true.
Women do go through emotional trauma. They do need to be supported through it.
I agree.
We need to learn how to ask for help also.
But you can imagine being a first-time mom, and this is the first time I'm pregnant, and this has happened to me. I have no idea where to turn for help. I don't know if there are any resources you could recommend.
You go back to your doctor, because we recognize that. Yeah, we recognize that as a loss. And if you feel you need to see a counselor, then we get you one.
Yeah.
Yeah.
So still on matters miscarriage, are there things we can do if, I know you've mentioned there's a way that nature has its way of
terminating pregnancies that are abnormal.
What we can do to prevent miscarriages in other cases?
Yes. Get pregnant when you're as healthy as possible, which includes eating right, sleeping enough. Don't smoke, don't drink alcohol, don't use substance of abuse, eat right, take care of, make sure that you are of optimum weight, okay? And that's both partners, okay, both partners. And then don't sit at home and assume it is normal to bleed when you start bleeding when you're pregnant, because that's a mistake a lot of women also make. Immediately there is a problem, please make sure you either go to hospital.
Any kind of bleeding?
Yes.
Has to be checked out?
Yes, it has to be checked out.
It has to be checked out. Wow.
Because sometimes it's as simple as, the point of implantation. where the placenta is forming, it may you may get what we call a subchorionic bleed. You may get a bleed under that area, and all we need to do is to put you on a progesterone to support the pregnancy. Yeah. So you need to see your doctor as soon as possible, or go to a hospital as soon as possible when you start having anything abnormal like bleeding.
Okay. That's important. That's good to know.
Yeah.
That's good to know. So as we wind up on our show today, when it comes to matters pregnancy and conception, what do you want to leave our viewers with? What are your top tips when it comes to matters pregnancy and conception?
Okay, one, don't assume it's as easy as we think. It's actually easier to conceive from IVF, assisted reproductive technology, than it is naturally.
Interesting.
Two, yes. Two, you need to learn your body.
Learn your body.
Learn your body and learn your cycle. Then you're able to have what we call timed intercourse. And then I always encourage the male partners, baby daddies, to be part of the journey as well.
Yes.
And also during the delivery. It makes a huge difference.
Are we having more fathers present at birth?
Yes. In fact,
so that has changed.
It's very... I can't remember the last time I delivered a baby and the baby daddy was not there.
How many of them are fainting on you?
None so far. You know the assumption, Christine, is that they will see the whole drama of the baby coming out and all that. No. So it makes a very big difference when the father of the baby is there and he gets those first pictures.
True.
And then the mother is here and she's assured, that somebody she knows is there to support her.
It's very assuring. Yeah. It's very assuring. Wow. I think for me, this has been, it's been an amazing, just this opportunity to learn from you. And I think we can comfortably say that conception is a science.
It is. And it's your responsibility. It doesn't just happen. You need to optimize things to be able to actually conceive. Yeah.
Yeah. So thank you so much, Dr. Monda, for coming through for today's show. We have learned a lot from you, and I'm sure our viewers have learned a lot from Dr. Monda. We thank you for your time, and we look forward to having you another time, to learn from you again.
Okay,
thank you so very much.
Yeah.
Thank you very much. Thank you for joining us on today's show. Today we talked about matters pregnancy and conception, and in studio we had Dr. Monda, an obstetrician and gynecologist, who then shared insightful points on how to prepare when it comes to matters conception. Something that we shouldn't take for granted that it just happens. We need to prepare our bodies when it comes to pregnancy and even before that, conception. We've been filming today at Little Cribs, a place where they're passionate about kids furniture 0 to 16. Exciting, beautiful, creative furniture. I know you love Ngong Road, I know you love your local fundi, but I can tell you, there's something different about beautiful furniture. Check out Little Cribs.